Okay, I see the official live notification there, so be on your best manners, folks. And we're looking for agency people who might be in the Zoom community out there in the internet land who wish to speak to the committee this morning.
Donna, we did get a list that Robin Cooley from Workforce Services and Jeff Rude from Insurance Commissioner are on. Are they available? I think.
Hi, Madam Chair. I'm sorry, I'm still having some computer issues, but I believe they are. Just a moment, please.
Okay.
Yes, we have, Madam Chair, we have Robin Cooley, we have Guy Bedoin from Department of Health Vital Records. I see Tom Laycock. I see Jeff Rude. I'm sorry, I see Jeff Rude, Robin Cooley, and Guy Bedoin.
Let's go ahead and let Robin Cooley in first.
I've admitted Robin Cooley.
Very good, thank you, Bonnie. And there she is. Good morning, Ms. Cooley. Welcome to Labor and Health Joint Committee. I'm hoping you're having a good Monday morning. Go ahead and address the committee, ma'am.
Thank you, Mr. Chairman, Madam Co-Chair. For the record, my name is Robin Cooley. I'm the Director of Wyoming Workforce Services, and we submitted a potential interim topic of interest for this committee on youth labor and work-based learning experiences. We did, I believe, send you a short synopsis of what we believe might be the interim topic for discussion. Can you hear me?
We can hear you great. Go ahead.
Okay, sorry. There's been a lot of discussion this past year, in fact, over how we work with our pre-apprenticeships, our apprenticeships, and our internships to get youth into some of these career technical education opportunities. There's been a lot of confusion around how the intersection of workers' compensation, federal OSHA requirements, as well as our child labor laws. There may or may not be an issue there, but I think there's potential clarification that would assist employers in this endeavor. The next gen sector partnerships, in fact, the industry partnerships through the Workforce Development Council have also indicated an interest in delving into this just a little bit more to clarify some of the issues in potentially our statutes, but also just working with the Department of Labor to meld these different requirements together for employers so so it's clear to them what their requirements are if they have some of these young people employed in some of these opportunities. I wanted to point out for you that we did set up a meeting with the Department of Labor, and the press release is going out today. It's scheduled for April 16th from 3:30 to 4:30, and I'll make sure that everyone on the committee gets information to register for that particular meeting. But that's really the issue that we think needs some interim discussion. And with that, I'd be happy to take any questions.
Questions, anyone on the committee? Go ahead, Representative Conley.
Thank you, Mr. Chairman, and thank you, Robin. I mean, this is a great topic, as you would imagine that I've been involved with DWS Advisory Council, but I'm also curious, and if it's okay with the chair, there's another topic on here in general in relation to workers' comp, and it's those, and the issue in general would be the lack of coverage of some workers in the state, those that work for companies that are self-insured from workers' comp. And I'm curious if you have just any input on that issue before you go.
Go ahead, Ms. Cooley.
Mr. Chairman, Madam Co-Chair, members of the committee, there are in our workers' compensation statutes, there are allowances for certain companies to self-insure. That is certainly something we could wrap into this topic. And how do we allow them to self-insure, but also require that if they do have these types of individuals taking part in internships or pre-apprenticeships, that these individuals are covered through workers' compensation. So that could certainly be wrapped into this topic.
Very good. We appreciate that, Ms. Cooley. Any further questions, committee? Thank you very much for speaking with us, Ms. Cooley.
Thank you.
Let's go ahead and let Mr. Rood in, please. Jeff Rood.
I've admitted Mr. Rood.
And there we see Mr. Rood. Good morning, Mr. Rood.
Good morning, Chairman Baldwin, Madam Co-Chair. It's good to see everybody. Committee members, I'm Jeff Rood. I'm the Insurance Commissioner. We have two other brief topics, I guess, for the committee to consider. One is just, I entitled it Regulatory Reduction. We've identified 2 or 3 areas in our statutes which have some mandates on the department and on industry, which I don't think are any longer really needed, certainly not useful or beneficial. One has to do with the mandatory reporting of all claims against healthcare providers, basically malpractice claims. This is something that came out of the 80s when there was a malpractice crisis in the state of Wyoming and there was no providers. There's a mandatory report from industry, and it's fairly arduous on their end and on ours, but I'd like to look at that and maybe make that optional at our discretion should the need arise. Right now we have 50 to 60 carriers and there really isn't a need. We also want to look at what's called the Health Benefit Plan Committee. This was something that was pre-Affordable Care Act, where we would get together with a whole board of people and determine proper plans and what should go into those plans for small group and the WIP. But once again, with the Affordable Care Act, it's really not necessary. And I'm also looking at part of that, something to do with claims reporting involving fires throughout the state. So we're looking at those. If the committee would agree and think they're no longer needed or can be modified, we'd go down that road. The second topic is something we've sort of had before the committee since the Affordable Care Act came out, which was responses to federal actions. This is really just us giving information to the committee on the current changes and how it affects Wyoming and where, what direction we may want to go in response to them. Certainly in the last administration, we had multiple changes to the ACA, and I expect that to continue with the current administration. But once again, I think these are smaller topics. I don't think they would take a large amount of time for the committee. So with that, I'll happily answer any questions.
Thank you, Commissioner Rood. And committee, for those of you that are new, these are kind of perpetual things that we hear on the committee most every year, is that we try to identify things that need to be reduced or cut back or in the statutes, and that would fall under this. And in response to federal actions, that's at least once a year, sometimes more. So these are things you're going to hear more about as we go through the next 2 years. Are there any questions for Commissioner Rood? Senator Hutchings.
Thank you, Mr. Chairman. Just on page 3, where we have maybe halfway down 26-1-124, is this something he wants to eliminate? This seems like it's very important to know about what's going on with the healthcare providers, whether they're getting claims against them. Just want to know about that.
Mr. Chairman, committee, I'm looking at if I've got the right, let me see, get the right one there.
She's addressing 26-3-124, the annual statement.
Oh, certainly, yes. Every year, there was a requirement started going back to the 80s, Mr. Chairman, committee. Every year, anytime there's a claim against a provider, the insurance company, if they paid out anything on it, would have to report it to us. And I think the thought was we can look at this and see how big of a problem there is in the state of Wyoming with the insurance providers. How many are there? Are there sufficient providers? On our end, it's very difficult because we gather this information. It's got to be coded a certain way, and it's often inaccurate. And there's a back and forth between us and the malpractice insurers. What I would like to do is, as a commissioner, I always have the opportunity to ask for specific information or have a data call. But this was a mandatory report that would go to the governor's office. And with the growth and with malpractice insurance carriers being more prevalent in the state, we just really, I don't think, no longer need it at this time.
Follow-up, Senator Hutchins?
Yes, Mr. Chairman. I don't know if it's just me, but it seems like there's a contradiction there. With the growth in malpractice, we don't need to report it anymore. Is that what I'm hearing? It seems like you'd want to know when my husband's gonna have surgery in a couple weeks, and he goes out and really does a lot of research on the physician. So having information about what's going on with a particular provider is very important to him. Am I reading this wrong, Mr. Root? Thank you, Mr.
Go
Chair.
ahead, Commissioner.
Mr. Chairman, Senator Hutchins, the information we get is more for a holistic approach of the market. It is completely scrubbed of individual doctors. I mean, you can't look at our report and say, Dr. Smith's a bad doctor. He had 12 malpractice claims against him. This is just for us to look at the health of the market. Are there enough providers to then, so if a doctor comes to Wyoming, are they going to be able to get good malpractice insurance? So it really wouldn't address that concern, Senator Hutchins, that you have.
No, and just to add to that information you would find in the practitioner's database, which is available and is a separate subject from what we're talking about here. Further questions for the commissioner? I see none. Thank you very much, Commissioner. We'll be in touch. Thank you very much.
Committee.
Let's see. I believe we have Guy from the Department of Health hanging out there waiting to talk to us.
Yes, we do. And Mr. Chairman, we have two additional individuals from the Department of Health, Franz Fuchs and, Matthew Petrie. Franz has his hand up. Would you like me to admit Franz first?
Great. We're always happy to hear Franz. Go ahead and put him in.
Good morning, Mr. Chairman, members of the committee. Can you hear me?
Good morning, Franz. We hear you great. Go ahead.
Good morning, Mr. Chairman. Again, my name is Franz Fuchs. I'm a policy analyst with the Department of Health. We don't have any specific topics to suggest. We are just here in support in case there's any questions. We have Guy from VSS, as well as Matt Petrie, the Senior Administrator of the Behavioral Health Division, just here to support if any questions are needed from the committee.
Questions for any of those departments, committee? This committee's asleep this morning, but we'll realize you're there, Franz, and we'll get back with you if you have anything. Thanks for coming.
Thanks, sir.
Let's see. I believe that's all the go ahead. Oh, we got one question for you, Franz. Go ahead, Representative.
I don't want to word this. On the maintenance effort you guys are doing when on these projects, do you have a report on what the maintenance efforts are going to be with some of this policy that's coming up?
Go ahead, Franz.
Mr. Chairman, Representative Stivar, I don't believe we have a recurring report on that, but we certainly can at the pleasure of the committee. To my top of my head, we have maintenance of efforts requirements typically with the early intervention, the DD preschools. There, of course, are some maintenance of effort requirements should the, for example, with the HCBS, home and community-based waiver services, should Wyoming choose to take a 10% increase in its match rate as part of the new American Recovery Plan. There are some maintenance of effort requirements on the waiver services there. So, but again, that's an optional deal. We've provided some information to the Appropriations Committee during our budget hearings, but we're also happy to provide that information to this committee as well.
Thank you, Franz. I see another question. Dr. Hallinan.
Thank you, Mr. Chairman. Franz, I'm going to ask you, there is a healthcare task force recommendation for cost controls. That's one of our issues. And in it, it says that the governor's health task force has established recommendations for cost savings to the Wyoming healthcare system. Are you aware of that, of that task force's ideas for healthcare tax or healthcare cost reductions? And if you are, do you think that is something that we could benefit from as an interim study? Thank you, Franz.
Go ahead, Franz.
Mr. Chairman, Representative Hallinan, I'm aware of the task force. I'm not as involved with the details, but I hate to throw anyone under the bus, but I think I see Jen Davis in the audience in person potentially. And she heads up that task force, and I'm sure we'll be happy to talk to you the details of what they're considering.
Thank you, Franz. As a matter of fact, we've got a couple people here who have participated in that task force. So when we get to Jen, I will ask Chairman Wilson because I don't want to talk today. Any further questions for Franz? Seeing none, thank you very much for being here, Franz. Stand by. We may come up with questions as we go. You know how that works. Well, since we mentioned it, let's let Jen Davis into the room. She's right in front of me. That figures. Go ahead, Ms. Davis.
Good morning, Mr. Chairman, members of the committee. I'm Jen Davis. I'm the Governor's Health and Human Services Policy Advisor. And there is an interim topic that Representative Hallinan mentioned that we put forward. The governor started a health task force last year, which started out of the COVID task force when he developed the 5 working groups. That task force has evolved into a working group around healthcare cost containments and how we might be able to leverage some different activities across the state to lower costs of healthcare. The task force has been meeting for about 6 months. Chairman Baldwin and Chairman Wilson are members of that task force, as well as Senator Dockstetter and Representative Barlow and Representative Larson and Senator Ellis. We have been working with the Department of Health and many stakeholders across the state, Wyoming Medical Society, the Hospital Association, Wyoming Primary Care Association. We have a large stakeholder group that is putting together recommendations to go forward to the governor, as well as the legislative body, of how we might be able to use those recommendations to specifically first look at costs. But as we know, that's tightly entwined with quality and access as well. So that work is continuing. Recommendations will go to the governor April 15th, and then will be heard by legislative leadership at the end of April. I would stand for any questions that you have.
Questions for Ms. Davis, committee. Go ahead, Representative Conley.
Sure. And does the task force anticipate needed legislation?
Chairman Baldwin and Representative Connolly, at this point, we're not sure. I would anticipate that there will be some recommendations that will come forward that may need legislative action to them, which also is why we have legislative members on that task force as well.
Further questions, comments, Chairman Wilson? No, she's asleep too. Thank you very much, Ms. Davis.
Thank you, Chairman. Thank you, committee.
Do we have anyone else in the waiting room which, from agencies who wishes to speak to us?
Mr. Chairman, I see Matt Martineau from the Wyoming State Board of Pharmacy.
Great. I know we have a topic or two from him. Let's go ahead and let Matt in.
I've admitted Mr. Martineau. I believe he needs to unmute himself.
Very good. Mr. Martineau, we're waiting for you to unmute and to hear you here in committee. I believe you're still muted, Mr. Martineau. Hear that, or you speak very softly.
Mr. Chairman, I believe he may have also joined by phone, so I'm going to try that route.
Okay, great.
There we go, I think. Now, can you hear me?
We got you. Go ahead, Mr. Martineau.
All right, sorry about that, Mr. Chairman. My name is Matt Martineau. I'm the director for the Board of Pharmacy. We saw during the COVID health emergency a lot of things going on where they were trying to mobilize pharmacists and trying to mobilize that workforce to try to help in the immunization efforts that have been going on. And some of what the federal government did through the PrEP Act, which stands for the Public Readiness and Emergency Preparedness Act, is to make declarations that set forth requirements for people to become a qualified immunizer. And right now in Wyoming, those things have preempted our state law and have allowed pharmacy technicians to participate in those immunization efforts. The board is concerned that when the public health emergency is declared to be at an end and those provisions go away, that the workforce the pharmacy workforce will have some significant challenges because they will have gotten used to technicians being able to do things that the Wyoming State Board of Pharmacy hasn't had the ability to allow them to do by rule before in the past. So the topic that we were hoping the committee would consider would be to amend the Pharmacy Act to authorize pharmacy technicians to be able to administer vaccinations under the direct supervision of a licensed pharmacist. And with that, I'd be more than happy to answer any questions the committee may have.
Committee questions? And I know, Matt, I see a couple other things we were talking about. We talked about some things concerning opioids, which probably you're not aware of. One of those being that there's a new opioid antagonist, and you're probably aware of that. That's in development, will probably be approved by FDA next year. In our language, when we did on the opioids, we specifically said Narcan or naloxone, and we may need to amend those things and create an opioid antagonist rather than just plain Narcan, as there may be more products actually in the pipeline. That was something that's been presented to us. And Chairman Wilson, did you have anything else that you'd heard of? No, I don't. Were you aware of that, Matt?
I was aware of it, yeah, but where we didn't have a definitive product yet, I wasn't sure how early we wanted to be on that one.
Yeah, I actually spoke with the manufacturer a couple of days ago, and that's something that probably early in 2022 is going to become available, be out on the market. And as I discussed with them, a lot of times, and I always use the example of synthetic marijuana, as each year we address different topics that are, or different substances that are out there and put them into our statutes. By the time that one gets in, another one just comes out, and this may be one of those instances. We need to be a little bit more progressive and just put a little bit more broad language to cover it. Anyway, I just wanted to make sure that you were aware of that. Are there any questions from Mr. Martin or committee? No questions. You're off the hook. Thank you very much, Mr. Martineau.
Thank you, Mr. Chairman.
Do we have anyone else from the agencies in Zoom land?
Mr. Chairman, I don't see anyone from the agencies. We do have a few additional people, if you'd like me to announce their names.
Let's go ahead and do that. We'll get the Zoom folks out of the way here real quickly. Let's go ahead and just put them in one at a time and announce their names as you put them in.
All right, I'm admitting Andy Somerville from WAMSAC.
Good morning, Andy. We see you and we can hear you. Go ahead and speak with the committee. It's good to see you this morning.
Thank you, Mr. Chairman and committee members. My name is Andy Somerville. I'm the Executive Director for WAMSAC, your Community Mental Health Association. And we submitted a few items for your consideration. The first is the House Bill 38 implementation process. We'd just like to keep that on your radar. That legislation does require a report back to this committee by September 1st, but we thought we'd add it just to keep it on the radar. The second topic that we submitted was implementation of 988. That is related to the Suicide Lifeline, which currently has an 800 number to it. And as of 2022, will officially transition over to a 3-digit 988 number. We'd like to talk to the committee about that process, how it will work, and additionally, the additional supports that the federal government and kind of national organizations are interested in pursuing with 988, including mobile crisis teams, crisis stabilization support, and a few other things. Of course, we've added the last two that we added were workforce development for mental health. We continue to struggle with having enough mental health providers in the state. We'd like to work with the committee on trying to identify gaps in that career ladder and how we can potentially get folks interested a little earlier in that field. And then finally is a review of the possibility of pursuing a mental health waiver through Medicaid, an 1115 waiver. We are still one of the very few states that funds their community mental health system, mostly on state general funds. Most other states have gone to some significant support through the Medicaid, either expansion or Medicaid waiver process. And with that, Mr. Chairman, I would stand for any questions.
Thank you. Questions, committee? Go ahead, Senator Furphy.
Thank you, Mr. Chairman. Well, since I'm new to the committee, Ms. Somerville, can you explain in brief terms, what 1115 or HCBS waiver means? Thank you.
Ms. Somerville. Yeah, and do it briefly because I know this is a one-day topic. Go ahead, Ms. Somerville.
Thank you, Mr. Chairman and Senator Furphy. An 1115 waiver is gives our state the option to kind of in our state Medicaid plan, look at expanding access to mental health services. Most states that use this type of waiver to fund their community mental health system do it to pull down the 50-50 match through the federal government. The home and community-based services waiver is another option that some states have used to expand funding. Primarily, the goal of that is to keep people receiving services in their community instead of going to an institution, and there are some funding advantages there. That's the very short explanation, Mr. Chairman.
Thank you very much, Ms. Somerville. And for the committee members, that's one of the things we'll be talking about in our Zoom informative meeting. Go ahead, Chairman Wilson.
Thank you, Mr. Chairman. Committee, I just wanted to add here on that item, mental health workforce development on the first page. Part of this is something that I've been talking to the mental health community about for a couple of years. Senator Baldwin and I are on a WICHE advisory group, and I heard 2 years ago, I think now, actually, year and a half, about some community mental health workers that Alaska uses to just train people in their community to help. I don't think we want to go as far as Alaska has, but I'm trying to track down information on that to get mental health people, the average citizen, in other words, some training to help them in the smaller communities. So I just want you to be aware of that additional comment. That's all, Mr. Chairman.
Thank you, Madam Chairman. And WICHE actually has somebody that comes out and does mental health specifically. And actually I was in contact with him last week. So are there any further questions for Ms. Somerville? No further questions. Thank you very much, Ms. Somerville.
Thank you, Mr. Chairman.
Let's go ahead and let the next person in.
Mr. Chairman, I've admitted Jeff Gardner from the Wyoming Community Service Providers.
Very good. Good morning, Jeff. Good to see you, Mr. Gardner. Go ahead and
Good
speak.
morning, Mr. Chairman. Good morning. I really don't have a lot. We did not submit an interim request. I just wanted to, I guess, make sure that the committee was aware that the developmental disability waiver program is in the midst of our next cost study, which will be presented to the legislature in the budget session next year. So I suspect there will be some discussion in this committee around that. And then, certainly the 10%, the additional 10% bump that Franz referenced earlier, that's a part of the American Recovery Plan Act. We certainly, would like to be a part of that conversation as well. And certainly the Appropriations Committee is aware of that and probably more appropriate in that committee, but we always value the input of committee members. With that, I would certainly take any questions specific to developmental disability waiver program or things going on there.
Questions for Mr. Gardner, committee? Chairman Wilson.
Thank you, Mr. Chairman. And committee, I just want to add something again, if you're taking notes. On the last page of the handout that I gave you, there's an item under other, which makes it sound small, but it isn't really small. We had this on our interim list last year, and just what with all the chaos of 2020, didn't really delve into it at all. But it says review of status of safety net programs in Department of Health, DFS, other agencies to evaluate the cumulative effect of funding changes. So I actually wrote here, this is where I wrote down, I made a note of Representative Stivar's question about the maintenance of effort. And there was a discussion, I think, from Franz about the match increases under ARPA. And I've actually put the DD waiver issue in here. I mean, that's kind of a lot of material to put in what's written as a kind of a small thing. But even last year, we had the thought that as we cut programs, we maybe need to really revisit, because those of you that are new this year didn't see, but last year, we had a lot of floor amendments about, property tax refunds or, the weatherization program or a lot of things like that. And it's, I think, a little bit, we maybe need to have a sort of a 30,000 foot level at what all the safety net programs are and how they've changed over the last 5 years. Where we're at with funding, do we need to rebalance? Have we created ourselves some pits or holes, and as Representative Stivar brings up, the maintenance of effort issue, which is really significant. If you've not served on labor or education, you might not be aware of that, but there's a lot of requirements as far as not cutting beyond certain levels when you're dealing with federal funds. So I just put that as a place, if you want to kind of put in some notes in this general topic, that might be a place for you to note them on your paper. Thank you, Mr. Chair.
Very good. Further questions, committee? I saw the yawn on the far right side. Nobody in the audience saw that. That's okay. Thank you very much, Mr. Gardner. I hope you saw that yawn on the other part of the committee.
Thank you, Mr. Chairman.
I see Mr. Laycock joining us. Go ahead, Tom.
Thank you, Mr. Chairman. Say AARP. I'm Tom Laycock with the Wyoming AARP. The AARP, Wyoming Senior Centers, and the Alzheimer's Association kind of have an interest in looking into long-term care costs in the state of Wyoming. If you're new to the committee, you may or may not be aware that the 2019 long-term care study by the Department of Health suggests Wyoming Medicaid spent $130 million on long-term care for Wyomingites in 2019, and that number could rise to between $250 and $300 million by 2030. A couple of reasons for this, not the least of which we're aging faster than any other state in the union. We also know the state pays for 64% of nursing home bed days in our state's nursing homes at a cost of about $4,300 per person per month. And I know we've worked as a state through the community choices waiver. That's the long-term care waiver that was mentioned earlier. But is there some work that can be done in terms of exploring federal options to increase and share in savings, or integrate Wyoming Health Home Services into data processing? Some of those issues that are out there to hopefully keep people in the homes longer and save money. We think that this is a well-timed effort for a few different reasons. First of all, we've had the debate on Wyoming Home Services recently, so there is a little more understanding for what that is and how we think it saves money. But also the State Department of Health has recently produced a long-term care study in 2017, a refreshed version in 2019. There's a ton of data available there, in addition to a recent study by the department studying the impact of uncapping enrollment in the state's long-term care waiver. We've also seen, this is the every 5 years, the Department of Health's Aging Division updates the state plan on aging. That effort is taking place in 2021. And one of the first things that they do to get there is actually send out a survey. There's been 1,000 members of the public who responded to that survey. So that once again offers us some nice data points. AARP, I think one thing that we hear quite a bit when we're at the legislature is what are we seeing in other states? Just to let you know, AARP actually has state offices in 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands, as well as some consultants that are happy to offer an overview of what's happening in other states around long-term care costs and what can be done. And we certainly pledge those capabilities to the committee as well. So all that said, we'd love to kind of put together more of a roadmap around what we think is important around community home and community-based services, and specifically how that helps the state save money. So that said, I'll be happy to answer any questions I can.
Questions, committee? We appreciate it. As last year or last several years, we've done some studies on long-term care on aging in Wyoming. Wyoming's not getting any younger. We're growing quickly, and that's going to be a topic we're going to be discussing, no doubt, for years into the future, all of our years in the future. Are there any questions for Mr. Laycock? No questions. Thank you very much for joining us this morning.
Thank you.
Is there anyone else out there online?
No, Mr. Chairman, that's everyone that was in the waiting room.
Very good. Then we're going to move into the room at hand. We're going to work from the front back, which means Representative Sweeney, you would be the first one with a chance. He shakes his head. Okay, he's not coming forward. Let's move across that next row behind him. Go ahead from this side up. If you want to come up and speak to the committee, All these people are shaking their head, no, what is the deal today? Miss Davis already spoke with us, so she can do that. Come on up, Nick, that's okay.
Nick Agopian, I represent the Wyoming Dental Association. The topic that I proposed, or the Wyoming Dental Association proposed, looks like it's on page 7 of your Chairman Wilson's document. Medical and dental practices in Wyoming, discussion regarding operating a small business. So you can read what I put down there. But as I'm going through all 12 pages here, it looks like bits and pieces go all across all 12 pages. If I'm looking correctly. You have it here under labor and licensing. I think there was some interim discussion. There was some discussion earlier about the Denturist Practice Act. I mean, there's a lot of discussions. I would also thank the committee for their support in helping update the Dental Practice Act itself to stay compliant with the national standards. Since I have the ability, looking at cost of healthcare, looking at insurance, and then I think the Medical Society has also identified healthcare transparency and patient empowerment. I think the topic proposed by the Dental Association touches on all of those things to a certain extent. And I think drawing some awareness around medical offices and dental offices in your community and the role they play in terms of employment, or looking at them in terms of small business. This year alone, especially with the shutdown for weeks, or in some cases months, of different offices, highlight the role that these offices play in their community as employers, and then looking at what are those statutory impediments to the operation of successful business, or what are those things that we've seen states do that certainly help provide lower cost care and ensure the success of small businesses. So with that, I'd stand for any questions.
Questions, committee? Representative Conley.
Chairman, thank you. Mr. Agopian, have you identified any statutory changes that are needed? I mean, it's general here, but is there anything in specific?
Mr. Chairman, Representative Connolly, immediately no. As we look at the insurance statutes in the state, they appear to really begin as the ACA came into play. And there isn't a lot of, there is some regulation, but specific to insurance related to dental care, there isn't anything specific, as well as looking, some of the other things identified would have been third-party payments, how dentists receive payments, either online or from insurance providers. I don't see that there's anything in the statute on my initial review of it.
Thank you.
Further questions, committee? Mr. Gopi? No questions. Thank you very much.
Mr. Chairman, thank you.
Okay, let's move down. You don't want to come up here? You can come on up. Even if it's just to tell us good morning, come on up.
Good morning, Mr. Chairman. This is Lindsay Simino with the Wyoming Counseling Association. We worked with Andy Somerville from WAMSAC on all of the interim topics. Good to see you. I think that she covered all of that very well. The one thing that I would add, since I'm here, on page 7, you will see that there's a proposed topic for licensure of behavioral analysis. As an association, we're very excited about this topic. As Madam Chairman spoke of with mental health workforce, we're going to be looking at different certifications and licensures, as well as different career ladders for common people. As you guys are looking at your time and your management, I think if we wanted to fold this topic in with workforce, since they're both possible licensing issues, that's something that we can do in order to make sure that this gets covered as well. And I do plan on reaching out to Brad Dickey, the contact person, and seeing what he's hoping to accomplish, so that we kind of have more of a unified front on the licensing issue moving forward. And that's all. Good to see you all.
Any questions? Go ahead, Senator.
Lindsay Simino with the Wyoming Counseling Association.
Who we've seen many times and we will see many times in the future, no doubt.
Wonderful. Thank you, Master.
Thank you very much, Ms. Semino. Nope, you're not coming. Okay. Oh, we had a question over here. You got to quit hiding behind representative over there. Go ahead. And you'll wait. Okay. You got plenty of opportunity. Okay, we're moving past that row. let's move to the next row back. Carolyn, would you like, yeah, you're hiding behind somebody there too. Come on up and there ought to be a rule that all the short people have to sit in the front row. Don't you agree?
Short people should be.
There's a song about that. Go ahead, ma'am. Introduce yourself and address the committee.
Good morning, committee. My name is Carolyn Passano. I'm the executive director with the Wyoming Healthcare Association, which is long-term care. And we have both for-profit and nonprofit members. Madam Chairman, good morning to you especially. Haven't seen you all this time. We're very interested in having a complete, extensive look beyond evidently what has come before. And it is extensive with the many looks at long-term care and pieces of it that have occurred to date. And but nothing seems to be coordinated on what the troubles are, and looking at where we're going to go in the future, knowing that we have had a downturn in our economics in the state. It does take a thorough look at everything that has been brought forward at this point, including what the AARP representative spoke about a moment ago, looking at what the governor has asked for the cost cutting, if you will, or the costs of long-term care. Because of the year of COVID, we are in a different spot than we have been in the past. And that has caused issues such as a census, a lack of census. And that in turn, when you have a facility that houses 100 residents and you have lost a quarter of them, the amount of money that it takes to run the facility without that income is very serious. And that then add to that the problem that we have with workforce, with staff, and knowing that we don't have enough nurses to go around always, and certainly not enough CNAs. And they are continually having to be trained, the CNAs I'm speaking of. And with that is cost. And when we don't have enough, we actually go to something that we call travelers. They are brought in from out of state, and we, the facilities, pay more money per staff member, be it a nurse, a CNA, whatever it is, than they pay for an in-state person working at their facility. In addition to thinking of, and we keep bringing everything back to costs, but there's more that has occurred and we have to think about. And that is during this past year, residents were in a lockdown due to CDC and CMS mandating that. Families did not come to the facility. The mental issues are who doesn't want to be touched? Who wants to not be able to pet the pet dog or the cat you left at home? It is a human issue that we are dealing with now. It's not just costs, although everything seems to come back to that. And the statute 424-104C says that the Department of Health will have a look at the base for long-term care, maybe at 3 years' time, but certainly at the 5th year. And as far as I know, that has never happened. And we are looking at costs and where we go. We need, that could be a part of the study for the 5th year. You have had a very good discussion regarding expanding Medicaid. And as you heard from AARP, a very large percent of the nursing home residents are covered with Medicaid. And what we know about Medicaid is that they start out funding very well. And as the years go on, all of a sudden, the state is picking up costs that Medicaid said they were going to pay. And because they drop out a little bit at a time, or maybe a lot at a time, we know that if the bill goes through in the Senate, that we will be looking at another program that is reliant on Medicaid. And the knowledge that they ease back maybe soon and maybe not so soon, that we're going to have to deal with that. And then we look at if a company, if a single owner has a nursing home that is, say, 100, and you take away the census, will you as legislators have to look at buying back beds that are no longer needed? We have so many issues to look at. I know that I saw the little packet today and saw all of the people that want to address you. And I'm not going to belabor where I am speaking about all of the issues that occur. I just know that it might not be my request. It might be several requests that are put together to come up with a study that hopefully will look at our future. And when I say that, I'm even talking about, do we need robots in nursing homes as they do in Europe with friendly little faces, and they carry food to rooms, they do all kinds of things. It's a big subject, and I won't belabor it, but I want to thank you very much for letting me speak.
Thank you very much. And I appreciate, and I speak for me, maybe not the whole committee, but I appreciate you bringing the human touch, talking about petting dogs and petting cats and the very human side of everything we do in this committee. That's a big deal. We talk about numbers and we talk about money a lot, but a lot of what we do has to do with actual dealing with people and feelings and emotions. And I appreciate that. Are there any questions for Senator Hutchings?
Thank you, Mr. Chairman. Mrs. Passano, you quoted a statute. Can you redo that? I missed the second number.
It's 42-4 103 or 104.
Roger that. Just one more question, Mr. Chairman. When you're talking about a study, are you talking about the state doing the study or the medical community doing its own study?
I was talking about your joint committee for the interim, thinking that you would be able, as a joint committee, to bring in all of the people that would need to speak to issues. And the issues, there's a plethora of them.
Mr. Chair, continue. Mrs. Passano, why can't the medical community sit together by themselves and do this study and then bring this information to us? Why do we have to do it?
I believe that there are going to be in-depth issues that actually go beyond the medical community. And we're looking at, if you want one more thing to say to you about the current people in Washington, the White House, and I understand that there is a business tax coming on the agenda. And if that does come, that will have to be looked at in a way because of the for-profit nursing homes. It will devastate those people that they already are paying taxes. And if there is a large business tax, it will be devastating. And I believe that the Joint Committee will have to look at what to do with senior care. And sometimes, too many times, when people have stayed at home too long, if they have very many comorbidities, they can go down very fast. When they get to the nursing home, those people have to go to the hospital in the first month. There's so many issues beyond just the medical side, even though we need to think about the LT 101 and how to look at that seriously when people have a very fast downward path.
Mr. Chairman, thank you so much, Mrs. Pasno. Appreciate your time.
And this is and if you'll notice on here, a lot of this has to do with the federal actions and what happens. It's a multifaceted thing, and it'll be an issue we deal with, not just this interim, but forever probably. Dr. Hallinan, go ahead.
Thank you, Mr. Chairman, and thank you, Ms. Passano. Has the CARES Act given support to the nursing homes during this time of the reduced census that they have in these facilities? And has it been a satisfactory amount? Does it need to be addressed by the legislature again? Thank you, Madam Chairman.
Thank you, Dr. Hallahan. Yes, they have been given CARES money, and it has gone for PPE, for the plexiglass, and some people have had to refurbish their facility itself. And I know you have to know this part, that there's a close off for a wing that is a COVID wing. And that has had some retooling done to it with those monies. And this is a side to that. I have had 2 administrators that did contact COVID. They lived in the COVID wing in the nursing home and continued to do their administrative duties as they were ill. It would be very good to have more money. Yes, it would. They have many costs beyond what they ever thought about. Some have put up tents to change clothes in before coming into the facility or leaving to go home. They have had travel trailers brought in to have a shower before going into the facility. And we know that when a community has COVID in very big amounts, that it's going to get into the nursing home. And when it gets there, it has had some devastating results.
Thank you. Representative Flittner.
Mr. Chairman, thank you. And I just wanted to mention to the committee that this is former Representative Passano, who is one of my mentors and friends. And she is a force and always has been and has not lost a step. So we appreciate this. Thank you.
Thank you.
Thank you very much. You did well for mentoring. Representative Flittner is a good product. Thank you. Oh, I wanted to make sure Representative Stivar doesn't have his hand up over there. Okay, let's. Go ahead.
Thank you, Mr. Chairman. I just wanted to follow up with former Representative Passano. I know that she has been really slaving away through this whole COVID year, trying to track down PPE and whatnot for her facilities. She had quite a lot of email conversations with all sorts of folks helping her out. So I know she's probably glad to see that year in the rearview mirror. I also did want to just say that my own mother passed away last year in assisted living, unvisited. So I take it personally.
Thank you very much. Our condolences there. Okay, we're going to move down the row. Looks like Ms. Bush is getting ready to jump up. Come on up.
Good morning, Mr. Chairman, Madam Chairman, members of the committee. Sheila Bush with the Wyoming Medical Society. I will be brief. I believe I didn't get a packet, but I think we're on page 7, maybe. It's very short at the top. Oh, thanks. Let's see.
You're actually on page 8.
Oh, I was close. So you are all familiar with our position on elevating the transparency conversation in the state within healthcare. We just wanted to put it in front of you as an option for an interim topic. Our approach this session was to not run a bill, but rather amend those acts that were opened by the profession themselves. However, we do want to be very clear that we intend this to span the entirety of the healthcare spectrum, all those licensed and delivering healthcare in the state, we think should be captured by the spirit and intent of this. And so I just present that as an option to run a bill that would, rather than us amending every practice act from here until forever, running one bill that would capture it in the spirit in one foul swoop.
Questions for Ms. Bush? From here to forever is not an understatement.
Mr. Chairman?
Representative Conley, go ahead.
Ms. Bush, do you know, are there examples from other states that have done what you're talking about?
Mr. Chairman, Representative Connolly, yes. This is part of a truth in advertising campaign the American Medical Association started over a decade ago. There are at least 20 states, I believe, who have this language that lives in their statutes in one form or another, all very different to suit each state's need.
Further questions from Ms. Bush? Representative Stivart does not have his hand up. Okay, moving down the row. Hospital Association's with us today. Come on up.
Morning, Mr. Chairman, Madam Chairman, committee members. Eric Boley with Wyoming Hospital Association and Leading Age Wyoming.
Mr. Chairman, Josh Hannes, also with the Wyoming Hospital Association.
We submitted 2 topics for your consideration, and I'm actually going to address one of those. And if it's all right with you, I'd like to ask the CRNA group and a couple other lobbyists to come up and talk about one of the other topics. But before we get to there's a lot of conversations come up, and I think we can dovetail a lot of some other considerations into topics that have already been considered. Obviously, long-term care is a huge issue, and we didn't submit topics, but you have several different avenues where I think it makes sense for us to take a look at long-term care, either through the Aarp bill or topic or through the other that you have at the bottom. I have a lot of information I can share with how CARES Act was used, and I think during the interim, we can spend a lot of time educating and talking about those. But one of the things that hasn't happened in a long time is the nursing homes have not been rebased. There have not been any increases. There just continue to be decreases. We've taken 2.5% cuts repeatedly, with another one slated to come through in the summer. And so I really do think that we need to take a look at not only rebasing, but reimbursement as a whole. And as we take a look at the need to take care of an aging population, we're going to have to come up with something more sustainable than what we have right now. We cannot continue to cut our way out of it. So I would just ask that might be one of the things that's added as we look at it. You talked about ARPA. There may be some money that we could use. Nursing homes are definitely a safety net facility and are needed in every one of our communities. And so there may be some money that we might be able to look at through ARPA. And also one of the things we talked about is what things look like post-COVID. And as Ms. Passano told you, this has been a year for the books, hopefully books that we can put in our past when it comes to our long-term care facilities. It's been an incredible struggle. they've done incredible things to protect those residents that they've cared for, but they have seen significant downturns in their occupancy rates. And there has been some CARES funding that's come to help kind of replace some of that lost revenue, but it hasn't made up for a fraction of what was lost just due to COVID. The other thing that I think Ms. Passano brought up, and I think it makes sense too, as we look at other topics and as we look at cost of healthcare, and as we take a look at maybe recommendations from the healthcare task force, which Josh and I both sit on. I think Medicaid expansion, if it doesn't pass through the Senate and we don't end up with Medicaid expansion this time, then it's time for the legislature to come up with a Wyoming solution. And I challenge this body to come up with that solution. We've been working on this now for 8 years. This is probably the best year for us to do it. But if we're not going to do it, if the legislature decides not to do it, we do need a solution. We need to find a way to take care of these folks in our communities and in our state. And so I would hope that would be one of the topics that's looked at in the event that it doesn't pass the Senate. The topic that I did suggest that came through our leading age side of things, Long-Term Care Association. I used to sit on the Wyoming Board of Nursing Home Administrators when I was a nursing home administrator, practicing nursing home administrator, still have that license. I no longer sit there, but I do work closely with the executive director of that board. And there are some statute cleanups that need to be done. And it should be fairly easy and straightforward. We can bring those recommendations to you, but it's been years since that's been looked at. So that would be an interim topic we'd like to see taken up. Josh has one other suggestion that would dovetail into one of the other topics that's been suggested, and I'll let him address that if that's right, Mr. Chairman.
So, Mr. Chairman, members of the committee, on page 11 at the bottom, there's a suggested topic for regulation of pharmacy benefit managers. We have an idea, while it doesn't need to be its own topic, I think does weave nicely with this one. And specifically, we'd like to explore some opportunities for state level action that would protect the 340B programs and covered entities, pharmacies that participate in that. It's an important program, particularly in our rural communities. And there's some actions at the manufacturer level and at the federal level that cause some concern for that program. So we'd just like to take an opportunity to look at potential state level solutions that would help.
Josh, would you like to go ahead and just explain what 340B is to the members? Because I know there's a lot of things saying, huh? Go ahead and just briefly explain that to us if you would.
Certainly, Mr. Chairman, and I'm not an expert, but at a very high level, it's an opportunity for covered entities or pharmacies, whether they're inside a hospital or a local community pharmacy, to purchase certain prescription drugs at a lower price so that they can provide those to lower income patients. The savings created are incredibly important. I mean, we have some really small hospitals in this state that generate savings upwards of $500,000, $1 million on this program, while also providing a benefit to patients.
Mr. Chairman, that money is actually brought back into those communities and is reinvested in access to care. And so it's a way that the hospitals, pharmacies, physicians can partner together, and they're able to offer the drugs at a cheaper price to the patients, but it also creates savings that's then reinvested for access to care in all of our communities.
Right. Mr. Chairman, if I may just quickly, we've had recently some hospitals suggest to us that should those programs go away, there are entire service lines that would need to be removed from their offering. So in rural communities, follow-up care for cancer patients, for example. These are the types of services that those savings, the revenue from those savings provides those services. So as an example.
Very good. And of note is that there's a lot of regulations that go along with the 340B program to stay eligible for those. It's a pretty in-depth topic, but it's important. Any questions? I didn't even realize Representative Worf was sitting there. Go ahead, Representative Conley.
Mr. Chairman and Madam Co-Chairman. Both of you have talked about the need for either Medicaid expansion or a state plan, that there's been 10 years of work and without one. And so that's about money that goes into providing of services. And I'm curious if you have for the committee what would happen if we didn't do either? If we kicked the can down the road again? What's the impact on our citizens? Do you have that information for us?
Mr. Chairman, Representative Conley, I think there are a lot of different things that we are already seeing take place and that we'll see continue. We have seen uncompensated, from a hospital perspective, we've seen uncompensated care continue to climb, which in turn, decisions are being made in every one of our communities on what services should or should not be continue to be provided. And in most of our communities, the hospitals provide 90, if not 100% of all those services. And so they're going to have to start taking closer and closer looks at what services they can continue to provide as a subsidy and still stay solvent. Our profit margins are narrow thin at best. From a human perspective, we are seeing people get sicker and sicker. We're seeing folks that if they had that coverage, they could have their chronic illnesses covered. They could see family practice primary care physicians and receive care to help them be healthier, which would actually lower the cost of healthcare in our state, as opposed to waiting until they're super sick and then presenting to an emergency room, which is the most expensive form of treatment for urgent and emergent care. I think that we'll continue to see an erosion of the financial health of not only health hospitals, but of healthcare in general around our state. And as we continue to see the uninsured numbers grow in our state, we'll see either people migrate out and then we'll have a harder time with workforce, or we'll see an increase in the uncompensated care. And I think that's an important thing to consider, is if we can help these folks have coverage and stay in the state. When we talk about the staffing shortages that Ms. Passano alluded to in long-term care, our CNAs are those folks that we could bring on and give them really good jobs if we could keep them in the state to care for our elderly and work in our clinics and in our hospitals. But those are the folks that we may end up losing as they leave the state. And I think it's only going to exacerbate a really difficult problem we're already having with staffing issues. Josh may have some other ideas too.
Mr. Chairman, I think I agree with all that, of course. I think the only other thing I would add is and I guess I'd ask the question, are we okay with the status quo? Is the way that our state exists in terms of its healthcare system and the number of uninsured people and the cost that exists to care for those people, is that okay with us? And if it's not okay with us, we have to do something different.
Further questions, committee? No questions. Thank you very much.
Mr. Chairman, I do have one final topic. If maybe I had Catherine and Mary Lynn come up, we'd like to present.
Absolutely. I see that Catherine moved to the front row and Mary Lynn can come up.
You're going to back me up. Why don't you come up here? Yeah. So, Mr. Chairman, it's a pretty simple one. I'll let them introduce themselves and we'll present it to you.
Okay, go ahead. Realize, although my clock doesn't work well up here, we're going to run out of time here pretty quick. So go
Catherine
ahead.
Wilkinson, representing the Wyoming Association of Nurse Anesthetists.
Mary Lynn Schickish, representing Banner Health, which are 4 hospitals here in Wyoming.
Mr. Chairman, the topic that we'd like to present is the CRNA Opt Out. And a lot of you heard the anesthesia assistant bill that didn't make its way through the full legislature this year, but it brought to mind the need that we need to take a look at the CRNA Opt Out, which would allow CRNAs to operate at the height of their licenses. We put this in as a potential interim topic. We're currently talking with the Department of Health and also with the governor's office, and it does not require legislation. It would just require the Department of Health to determine that it can be done. I think it requires some rules changes, and then it would require the governor to sign a letter. But we did want to put it on your radar in the event that we do need legislation to advance this and allow CRNAs that opportunity.
Very good. Okay, thank you very much.
Mr.
Okay.
Chairman, may I stay up? I have a couple other issues that I'd like.
No, yes, you may. Go ahead, Mary Lynn.
Thank you.
Again, Mary Lynn Schickish, I represent the senior centers here in the state, as well as Central Wyoming Hospice and Transitions. I wanted to add on, not pile on, but add on to the issue about senior services. I think we've heard a lot about it. And in 2017, when the Department of Health did a really excellent study looking at the long-term implications for all of us with folks going on to Medicaid and into nursing homes and what the cost implications were, they came up with 4 general recommendations that helped the issue of keeping people into their homes. And some of those require legislative action. So I would kindly ask that we do keep senior services per se on the agenda, because we are scheduled to be about the 2nd to 3rd oldest state in the union by 2030. And just point out that senior centers tend to serve as sort of the central point in many of the communities, and maybe we should evolve what their role will be. I don't suggest that we have more money to spend, but maybe just some policy considerations for the future. Similarly, I think as Chairman Wilson pointed out, it was a very sad time during the era of COVID. Unfortunately, but really we didn't speak about it much, as many folks who ended up being terminal in the case of COVID went on to hospice. And in Casper, our hospice became a very central locale for families who could see their patients because of the lockdowns in nursing homes and assisted livings. Their role really grew during the era of COVID. And I think they are part of our overall continuum. We all know that the lowest kind of care you can receive at your end of life is not in a hospital, but in a hospice setting, either in home or in a hospice itself. So with your permission, Mr. Chairman, Madam Chairman, I think that's an issue for us to take in that whole era of senior services. Thank you very much.
Thank you very much. Questions from Ms. Kisic? Oh, Representative Chairman Flitner.
Thank you, Mr. Chairman. And Marilyn, did you have specific policy changes in mind when you threw that out to us?
With regard to hospice, but I think it would behoove this committee to hear about hospice in Wyoming. It's not real coordinated services. Some communities, for instance, Powell, have attempted to start hospice. The startup might be kind of expensive, but I think we need to bring to you the ideas. Specifically today, I don't have them, but I think that if anyone's had the opportunity, I know my father went through hospice, and I am forever grateful for that experience for the hospice in Casper. We kept him in our home, but it really was a low-cost way to help people reach that phase of life, the end of life. It's a very spiritual experience, I will say. So I would hope that the committee would consider it, and we could bring ideas forward to you. Thank you.
Thank you, Ms. Kisic. Okay, and I lost my place on that row, but if there's anybody else on that row, come on up. See, Catherine's confusing. She keeps changing rows. It's confusing me.
There we go. Good morning, Mr. Chairman, members of the committee. My name is Tammy Johnson, and I'm wearing 2 hats today. One with the Equality State Policy Center, and in the packet you have a proposal for maternal health, to study maternal health as an interim topic. And I just wanted to put that in front of you. Some of the data and facts are in the packet, but just to highlight, Medicaid expansion would give pregnant women and their babies extended health care, more than what they have now. In addition to that, an interim topic studying maternal health would help the state understand the complications and the long-term impacts related to maternal health. Right now, we have about 60 OBGYNs in the state. If women don't have access to preventative care during pregnancy, 1/3 of pregnancy-related deaths maternal deaths happen during pregnancy. 1/3 happen as complications resulting from birth, and then about 1/3 happen within a week after. And many of those conditions can be prevented if women have good maternal care during pregnancy. So I'd just like to bring that forward to you. There are several kinds of topics that you can study. I think it's detailed in the piece that was submitted through Equality State Policy Center. So if you have any questions about that, I'll do my best to answer those. The other thing that I come before you today with is a few things in the packet that deal with labor. And the one that is kind of highlighted to me is the vaccination piece that's on page 8. I did not bring this forward to you, but it was noted to me. So I thought I'd share with you. The AFL-CIO and its affiliates kind of agree with this topic, that we don't support employers requiring people to be vaccinated What we do support is education, accurate and clear, transparent education on vaccinations and access to vaccinations. So those are the things that are most important to the workers, that they are well informed about the pros and cons of vaccinations and that they have access to them. And I'm happy to answer questions about that. Another one that jumps out at me is the rescission of at-will employment. That would be fabulous. We'd love to see that happen. I know it's not well filled out. It was submitted by Representative Romero Martinez. But if that's something you'd like to investigate, I would be happy to provide you with gobs of information about that. So, and I would be working with Representative Romero Martinez on that. So, finally, there's one on youth, youth labor and work-based learning experiences. And we would be all for having workers' comp coverage for those 16 and 17-year-olds who do find themselves in the workplace learning skills. I would let you know that the Department of Ed and the Department of Labor have been working on pre-apprenticeship programs in the high schools. So that may be a less dangerous, maybe more appropriate place for that early learning in apprenticeship programs. But I'm not opposed to the bills that are running right now that would build up workplace experiences. But if we do need to, there is a bill running right now that would add workers' comp for those young people. But if that weren't to fly or something, I think this would be really worth looking at and figuring out how it would get paid for and all those things. So anyway, if you have any questions, I'm happy to answer them.
Very good. Difficult questions for Ms. Johnson.
Oh,
Go ahead.
boy.
Thank you, Mr. Chairman. Ms. Johnson, when Director Cooley was on, I asked her about kind of expansion of this topic to include the reality that we have workers' comp for some organizations and workers in the state, but not for others. And that an expansion of the topic to include looking at workers' comp in general. And she informed us that she could be providing information and it could be rolled in. Could the AFL-CIO also participate in that kind of discussion?
Mr. Chairman, Representative Connolly, absolutely. We did do quite a bit of work on the special session workers' comp legislation, and I hope that we can get that extended. Right now, the really interesting caveat that I don't believe a lot of people know is that under the NACE codes, an extra hazardous person is under the Constitution. Any occupation that's deemed extra hazardous is required to be and have workers' comp coverage. Under those NACE codes, there are many occupations that are not identified as extra hazardous. And so those people are not covered. For example, teachers, there's only a handful of teachers in a school district that are covered. And it's increasingly more and more likely that a teacher can be hurt on the job. We have a lot more kids who do things to teachers that make them, miss work. And then there's just, there's illnesses and things like that teachers can get more easily. The other issue that's more important, I think more burning, is we have a lot of private insurance carriers. A lot of industries opt into private insurance carriers. So for example, with the workers' comp piece that you guys passed for COVID, those employers are not covered under workers' comp. They have to prove that they got they have to prove they got the illness at work. And it's highly likely that a grocery store worker, for example, would pick up COVID, the hundreds of people that go through his or her line every day, but they're not covered. So that's proving it. And private insurance carriers, I hate to tell you, often don't fulfill the claims. They make it very difficult. And people who make $7.25 an hour don't have the resources to pursue those claims. So it goes by the wayside and they're left uncovered. And that goes beyond COVID. So I think, Representative Connolly, to your point, that a deep dive into workers' comp insurance in the state would be highly effective and a good use of this committee's time. And we could come out on the other side with some really helpful workers' comp legislation that does what workers' comp is intended to do. And don't forget, workers' comp is the quid pro quo. We're running an immunity bill right now, a business immunity bill, but workers' comp is business immunity. So when workers are covered under that, they don't have a case against their employer because they agreed under workers' comp that they're not going to sue their employer. The workers' comp system is going to take care of any workplace injury or accident. Further, just to let you know, April 29th is Wyoming, it's a National Workplace Injury Day. And we always do some stuff around that. But Wyoming is first in the nation in workplace fatalities. And we need to change that. And I think having more progressive, more comprehensive, more applicable workers' comp legislation will help with that. So I'm happy to answer any other questions. So that's a big, long-winded yes, affirmative, go, go, go.
Senator Hutchings, go ahead.
Thank you, Mr. Chairman. Ms. Johnson, when you were talking about the Constitution and forgot exactly what it was, were you talking about the mines and Article 10, Section 4? Can you quote what you were talking about in the Constitution in regards to workplace or workers' compensation?
Mr. Chairman, Senator Hutchings. No, I can't. I don't know the citation in the Constitution, but I can get it for you. I just don't
That
have
can
it
be a
off the
side
top.
conversation, maybe. You can get that
Yeah,
from her.
I'm happy to get that for you. And
I believe it deals mainly with mining, right? If you can recall just that part.
I don't, Mr. Chairman, Representative or Senator Hutchings, I don't believe so. It says any, I think it, I'm roughing it here, but any occupation that's deemed to be extra hazardous. And then we define extra hazardous in statute.
Thank you, ma'am.
Okay. We're going to move on back further in the rows. Yep.
Am I
somebody's
done?
end up. You're off the
Thank
hook.
you,
Thank
Mr.
you very
Chairman,
much,
members
Tammy.
of the committee.
Come on up. If you're thinking of speaking, scoot on up to the front row here so we can get going. And
Good morning, Mr. Chairman, Madam Chairman. My name is Heather Rode and I'm with Blue Cross Blue Shield of Wyoming, and I'm joined with our good friend Wendy Curran up here. We didn't present any topics, just wanted to introduce ourselves as a resource. We're going to have lots of educational conversations about health insurance potentially, and wanted to let you know that we are here as a resource for those conversations. We'd also support Commissioner Rood's discussion about the fact that there are many federal actions that are coming through to impact insurance, and are happy to talk about how those are impactful. And we are both also sitting on the governor's task force for healthcare cost control. So happy to talk about what those look like as well. So we can make that pretty brief. And Mr. Chairman, I don't know if Wendy has anything else to contribute, but no.
Wendy is
Usually not.
speechless. Committee, please make note of that. But Wendy Curran was speechless today. No, thank you very much. We will see you a lot. Were there any questions for these guys? No questions. Thank you very much. And let's see, come on up. You're not in the back row, you're on the side row.
Mr. Chairman, members of the committee, I'm Jan Cartwright. I work with the Wyoming Primary Care Association. And I want to suggest, with a nod to current bills and Madam Chairman's work around healthcare recruiting, to be considered as a broad topic. There's a few reasons for that. First of all, Wyoming no longer has an area health education center funding, which is federal funding to encourage students to go into healthcare careers. We also saw in 2016 the loss of tobacco master settlement agreement money that went into provider loan repayment. And we currently are looking at that bill around provider recruiting. So we've got some strikes against us. And I want to remind the committee that we compete with all of the states around us and nationally for not only providers, but administrators and people within the healthcare system. I will give the Colorado example as one, wherein my counterpart in Colorado knows of 97 open positions for providers and feels strongly that she would never be able to fill those. And so recruiting into our rural areas is a whole other skill set. And I think it's important that we all are on the same page. This in light of the fact that we My organization actually got funding this year to put in a full-time position around recruiting and education, working with those pipelines, encouraging students to take up healthcare careers. And we couldn't do it alone. So we would want to partner with this committee and with others. There are others in the state who are doing it, obviously, but that's my suggestion at this point.
And those are very good suggestions. Questions, committee? A voice unheard from. Go ahead, Representative.
Thank you, Mr. Chairman. I was just wondering, we're hearing a lot about the need for a workforce. It was my experience that through the CNA schooling, I know there's a good school at CWC in Riverton, but there was also some in even high schools getting some CNA training. My question to you would be, is there any information on why these people don't stay in that and what can be done to change that? Thank you.
Mr. Chairman, Representative Ottman, I think that is a very key question. I'm not saying there aren't some bright spots around training in the state. I think those high school programs are very positive, but I don't have the answers to why people don't stay in healthcare or don't choose to go into healthcare. So I think that's part of, I guess the broad question is, does the state have a role in helping to recruit providers and people to the state? And, so I think, and I want to give a nod to the committee chairman who are going to do some education this year. We certainly would join in that, but I think that's a big question and I don't have the answer to it.
Very good. Committee, further questions? Okay, thank you very much, Ms. Cartwright. We have a few more moments if we got it. Come on up.
Good morning, Mr. Chairman, Madam Chairman. My name is Dave Pickard. I was approached by the American Massage Therapy Association. Wyoming is one of the only 3 states that do not have a practice act for professional massage therapists. And we would encourage the committee to undertake a look at that throughout the interim. I do have a draft bill that just didn't make it into this process for the general session. So if it becomes a topic, approved topic on your list, that would be fantastic. Otherwise, we'd just like to keep the committee apprised of how we're going forward with that process.
Very good. I could use a massage about Thursday. Go ahead, Representative Conley.
Yeah, I'll take Wednesday. Mr. Pickard, I am curious, who do you represent? If we don't have a practice act for a massage therapist and people can get massages from whomever, what's this group that you represent?
Sure. Mr. Chairman, Representative Connolly, the American Massage Therapy Association is the professional association that represents a couple tens of thousands of massage therapists throughout the United States. There is another organization that is of a similar name, and it also is supportive of Wyoming coming up with a Practice Act. The benefits of a Practice Act would clearly set out the scope of practice, what the required education and training levels are, what means a consumer in Wyoming would have for filing a complaint or a grievance. And essentially, with all Practice Acts, you're really recognizing that the profession that has gone through an enormous amount of training has a license to practice in the state of Wyoming. It provides value to their profession. And so for all of those reasons, they would like to be licensed in the state of Wyoming, have those benefits afforded them that other professions have under Practice Acts.
Go ahead.
Are massage therapists in Wyoming members of these 2 organizations? And do they have a group that you're representing, or are you representing the national organizations?
Go ahead. Mr. Chairman, Representative Connolly, great question. There are about 350 members of the AMTA in Wyoming, and the other organization has a similar number of professionals that are members of that organization. They call them chapters. So it's the Wyoming chapter of the AMTA that I'm representing.
Very good.
Great.
Thank you very much. Mr.
Thank you.
Pickard. Oh, there's one more. You're not off hook.
Super
Senator
quick.
Hutchins.
Thank you, Mr. Chairman. Really quick here. Is it possible this could be a personal bill instead of a committee bill?
Mr. Chairman, Senator Hutchings, I wanted to bring the committee's attention to the idea that we're going to be drafting a practice act. If the committee during the interim wants to participate in that process, we'd certainly welcome that. But we will be working on a draft bill for the 2022 session.
Very good. Thank you.
Thank you.
And that brings us to the gentleman who's been very patient, sitting in the back. Come on up. You're the last one to present to us today, I believe. And no, yeah, both of you can come up. You've both been very patient in the back row. And we're just about out of time. We got to work everything we've heard, but go ahead, gentlemen.
Mr. Chairman, Madam Chairman, we thank you for having the opportunity to speak to all of you, including the members of the House, members of the Senate. My colleague and I, Ed Young.
Can you introduce yourself, please? So just for the record.
My name is Ed Stevenson. And this is Ed Young.
Okay, go ahead.
Thank you. I am in ministry. I'm a missionary. So is Mr. Young. But we're wearing two hats. We submitted a proposal over a month ago to various members of the Revenue Committee on the House as well as on the Senate. It was a proposal to replace the revenues that were lost due to the downturn in the minerals extraction industries. This happened shortly after Governor Mark Gordon went on Fox News and declared that the actions of the US government through the Biden administration was disastrous for the state of Wyoming. It was devastating. We have a plan. We've submitted a very preliminary proposal that would replace those revenues in large part or even surpass it. It would go a long way to bring economic diversification into the state of Wyoming, as well as to take the state's participation into the economies worldwide for even further diversification. We are not proposing, and we have not submitted any request and will not submit any request for any funding from the state of Wyoming to make this happen. We are simply trying to do our part. We are here by virtue of the calling of Yahuwah Elohim to this state. That's what we've been here since about 2014, off and on. This process involves the launch of a new type of comprehensive health program. None of these companies have been formed officially yet. The first one to be formed would be the Wyoming Comprehensive Health Program. It would consist of two components. One component would be a traditional major medical group plan operating with a traditional customary insurance guidelines. The other would be a private banking arm of the Wyoming CHP, which is the short name for it. And it would provide the use of a private banking facility to all of the members of the CHP. The CHP is designed to be a private member organization open to everybody. Now, having said that, the investment banking arm, the private banking facility, operates on statistical certainty as opposed to market probability. We use collateral-based assets in order to indemnify all capital and the growth of that capital. The process of continuous capital formation ensures that capital is continually being produced year after year after year, as long as the process is not interrupted by either the member or anybody else. In this program, there are no government subsidies. There is no unauthorized government intrusion either into the affairs. The system works in such a way where the insurance portion would pay the typical insurance covered costs. What is not paid by insurance would be paid by the private banking arm, the private banking facility, including, as the gentleman over here said, licensed therapist, chiropractic, you name it, dental in some cases, anything. Nothing is excluded. All of the rights and entitlements for freedom of healthcare are restored back to the actual member. The program is still, it's just being launched right now. We met with the banking commissioner, Albert Faulkner, last week. We have a meeting set up with Mr. Rude tomorrow, and we intend to move forward with it. We've introduced this proposal. I didn't know about this type of a procedure until, thanks to Mrs. Wilson here, told us about it. But we'd like to introduce this topic for future consideration. Thank you.
Very good. Any questions, committee? Go ahead. Oh, go ahead, Senator Hutchins.
Thank you, Mr. Chairman. Gentlemen, both Mr. Eds, is this kind of like a MediShare, Liberty Health Share on steroids kind of program? Thank you, Mr.
Chairman Baldwin,
Go
Madam
ahead.
Chairman Wilson, it is not.
It isn't. Thank you.
We're not discussing steroids today. Any further questions? Thank you very much. We'll look forward to hearing more from you.
Thank you.
Thank you very much. I think we've hit everybody in the room. I kept wanting to call on Mike to testify when he was up here. Yeah. For those who don't know, he's the most important part of our committee. He doesn't have to testify today. Chairman Wilson, where would you like us to go from here, ma'am? I'll let you take it because I'm losing my voice.
Thank you, Mr. Chairman. So committee, what we typically do now is just go kind of down the row and hear from you folks what your top several, 3 or 4 priorities would be. And then Chairman Baldwin and I will take that into consideration as we put together the list. So I'm just going to start on that end and work my way this way. And keeping in mind that we have 15 minutes roughly before we have to be on the floor. So it'd be good to be prompt. So Representative Romero Martinez, what's on the top of your mind? And you don't have to confine yourself to what's on the list, obviously, but.
So what's on the top of my mind is the top of my mind would be the on page number 7. I believe page number 7. I'm going to work backwards is the rescission of at-will employment. It's a conversation that I want to start having. It doesn't have a complete solution to it, but I'm open to conversation on that piece. Of course, also on page number 6 at the bottom of the page, Healthcare Freedom of Conscience Act. That's also on the top of my mind. Doctors or nurses who are in a position where their beliefs tell them they should not participate in some type of action. And then, of course, last but not least, on page number, I think it's page number 10. Guess not. Excuse me, Madam Chair. There's a lot of pages here.
You should have seen it when it was 40 pages.
And it said the same thing over and over and over.
The other one would be on page 8. My apologies, is a state constitutional amendment, protection of the life of every unborn child. And those are my top ideas. Thank you.
Great. Representative Stiver.
Thank you, Madam Chairman. Long-term care that Ms. Representative Passano brought up, vaccines, and the unforeseen consequences of just had it on my maintenance of effort. That needs to be done because if we don't do that, we're going to bankrupt the state. Thank you.
Thank you. Representative Worf.
Yes, Madam Chair. I too would like to focus on the cost controls. That was one of the topics that we talked about earlier with some of the legislation that we considered. I also support the idea of looking at the alternatives to Medicaid expansion. I think that's something that's been touched on, but I do think we need to be looking at alternatives. I think it's important for us to take on this issue of how we handle healthcare in this state, and that the whole expansion of the thing. I mean, I think we need to look at our nurses and all that. So I think there's a lot of good ideas, but those are probably the 3 topics that I would like to focus on, Madam Chair.
Representative Worf, on
Thank
that
you.
last one, were you speaking, when you mentioned nurses, are you speaking specifically about the workforce issue? Or?
Yes, the issue that Ms. Passano brought up. I think that's one that warrants further exploration. So,
okay. Great.
Thank you.
Thank you. Representative Flitner.
Thank you, Madam Chairman. And I don't know if y'all noticed, but pharmacy benefit managers is a top priority.
Yeah, we did. didn't hear from any
Maybe
pharmacy
s-
benefit manager people.
No, but they did submit their request. So I guess that would be number one for me. And then also looking at the long-term care costs, especially for our seniors and hospice and in-home care, workforce, the census, everything that was mentioned by Ms. Passano. And then also the youth labor and workers' comp issue also is of interest.
Okay, Representative Hallinan.
Thank you, Madam Chairman. I have kind of a list. On page 1, I like the community mental health service review. I think we need to look at that again. I think that the idea of the alternatives to Medicaid expansion needs to be looked at. I think the long-term care, the costs of healthcare, I think is definitely an issue we need to look at. I think that the long-term care issue is probably the top issue. I think we need to look at that and all of its ramifications, which include the CARES costs that the mental health or the long-term care institutions have had to undergo with very little help from the federal government. I think that the senior citizens need to be addressed also. I think the labor and work-based learning experience is a worthy issue. I think that the healthcare transparency and patient empowerment is a worthy issue. And I think the last issue is the item that only got included on this list under other. I think we need to review the status of safety net programs in the Department of Health, DFS, other agencies to evaluate the cumulative effect of funding changes. And that is my list, Madam Chairman. It's a pretty extensive one, but I think it's those are all worthy issues we could discuss.
Very good. And just think we might get 6 days. Senator Furphy.
Thank you. I only have 3 issues. The long-term care, we need to keep seniors in their homes as long as possible. So I think we need to address that. If Medicare expansion doesn't pass, we have to get serious about a state solution. So that's going to be a big issue. Then finally, once again, we've talked about it for years, our healthcare costs are out of line in our state, so we need to continue to address those. Thank you.
Great. Senator McEwen.
Thank you, Madam Chairman. As usual, I'm probably going to shift gears and head a different direction. I think we need to take a serious look at privatizing workers' comp and unemployment insurance. Right now, it's ridiculously expensive. And I heard comments today. I own grocery stores. And in 2008, everybody in the grocery store had health insurance. And then guess what happened? The government got involved. So what we were doing was illegal. It had to be done through Obamacare. And here we go, shoving ourselves into a situation to try to fix things. And I think we're just going to make it worse and more expensive and more wonderful. At the end of the day, I work in a co-op of grocery stores that stayed open during the pandemic. I don't know of one that shut down, so I don't think it's extremely dangerous either. Thank you, Madam Chairman.
Senator, if I can just confirm, so were you speaking about workers' comp insurance or health insurance or both?
Workers' comp and unemployment, Madam Chairman.
Just making sure.
We're one of the very few states in the nation where you can't make a choice. About 95% of every employer in this state has to have workers' comp and unemployment insurance. And the truth of the matter is, I have 48 employees in 2 grocery stores. Workers' comp and unemployment in the state of Wyoming
Costs me close to $200,000 a year out of 2 small stores. And I think a lot of the other small business people would like to find the same coverage that's available in other states for about 1/3 to half of that. Thank you, ma'am.
Very good. Thank you. Representative Otten.
Ooh, okay. There
Put on your
was,
speaker.
thank you. There's kind of two combinations with the vaccinations on page 8 and the immunizers on page 12. So that, long-term care for sure. Then also the healthcare cost control, page 2. And then on the first page, the Title 25 people that seem to be getting kind of lost in the shuffle. So that, all of them are good. All of them are very important, but those would be the ones I would mention. Thank you.
Very good. Thank you. Representative Connolly.
Thank you, Madam Chairman. I too have a long list, but I'd like to start with saying that I truly hope that we do pass Medicaid expansion, that it would cost us tens of millions, if not $100 million a year to do that alternative. And we have looked at that already over and over again. And I'd like us as a committee to be able to look to the future and regarding positive outcomes for our citizens in relation to health. Without the resources that come from Medicaid expansion, all we're going to be doing is picking and choosing the winners and losers. Who's going to die? Who's going to get care? I don't want to do that. I don't want to do that. I want to do things that are going to help us. And that being said, I would like for us, and clearly aging, long-term care has to be a priority. Mental health and suicide prevention, looking at the safety net programs, maternal mortality. And then I think it would be kind of interesting and fun to look at the workers' comp issue in all of its manifestations. So thank you, Madam Chair.
Okay, hang on. I'm gonna make sure you talked really fast.
You told her to.
That's true. That's true. Let's see, the safety net programs, the maternal health and the workers' comp, right? Did I stay? Okay. Okay. Very good. Representative Clifford.
Yeah, thank you, Madam Chairman. My priorities, I too would echo Minority Floor Leader's efforts that Medicaid expansion means more to my people than anything right now. We lead the disparities in a lot of health groups just across the board. And with that, my priority would be maternal health, the mental health, substance use.
Wait. Maternal health.
Mental health.
Okay.
The youth labor work-based learning. And then aging, the long-term care costs in our future. Thank you.
Thank you. Senator Hutchings.
Thank you, Madam Chair. I'm going to do this really quickly. We're going to do the Healthcare Task Force recommendations for costs. I'm going to echo Senator McEwen on privatizing healthcare, insurance and workman's comp, the youth labor and work-based learning, and the regulations on pharmacy benefits. Thank you.
Okay, Senator Bouchard.
Thank you, Madam Chair. I had a vaccine bill, so obviously I care about that subject. Also, on naive opioid prescriptions, we need to get back on that. We kind of changed things when we restricted prescriptions, and we have people that are in chronic pain, and they're kind of caught up in the mix there. So we really got to fix that. Regulations that we can remove. I mean, we talk about cost control. I've brought this up several times in the committee, and I think we need to start focusing on things that maybe we can get rid of that are causing a problem and making more cost. So that's kind of just what I'm gonna, I'll leave it at that. Those are good additions.
Okay, great, thank you. I think co-chairman and I will work over the list. We'll add ours in probably later unless you want to make any comments now.
No, I say we'll work it and we'll supply a list to you of the priorities as we heard them and saw them. We'll put together a list and make sure all of you get it. And additionally, we have a meeting at the end of next week or the 16th
Management Council.
with management.
Yeah,
council.
so what happens next for those of you who are new or in the audience? Once we come up with the list, that goes to Management Council, who is meeting, I think, April 16th, okay. And we have all the committee, it's an all-day meeting. It's very painful to sit through or be on the dais, as is Representative Connolly. And all the committees present their lists, and then Management Council tells us what the list is. And we're really not allowed to address issues that are not on the list because obviously the legislature is paying for our days. And you might hypothesize that if we gave them the list of all these things, it would far exceed the 6 days that we're likely to get. And I'm hoping for a 7th by Zoom. So I will just add, Mr. Chairman, co-chairman, one thing. We didn't really hear it verbally from people on the regulation of pharmacy benefit managers. I will point out to the folks that sent that in that the estimated committee time for a topic, 2 to 3 days, that would be half our entire committee time. That's not possible. I'm just being really blunt. So if that is of interest, and we've heard the issue before, we're not saying it's not of interest, but I think the group there will have to really do a lot of work ahead of time. Some pharmacy issues will be on the agenda, so we can, I assume, but that group is going to have to really prepare a lot of material and maybe even a draft bill because we certainly won't have 3 days to discuss it. We'll be lucky if you even have 3 hours, and that probably is more than you'll get. Anything else?
That's it.
Okay, Senator Bouchard.
Thank you, Madam Chair. I just want to add that the people that are in the room that maybe want something, there's personal bills, things that people can do, work with the legislator. Because we're gonna get crammed and anyway, I think.
Right, it'll be a budget session, 20 days. And so certainly all the people who are on this committee have interests. You've heard the interests that people have. So if it's something that doesn't show up on the list, certainly visit with a legislator. We're always glad to do that and learn more, and have a good week, everybody.
Go forth and conquer.